Introduction. Day 1 of HEMEpath rotation. You arrive in the sign-out room and are given 1 or 2 bone marrow cases. Do the differential and we'll discuss them in a few hours, your fellow or attending says, as they rummage through their stack of cases. Be sure to read a lot while you're here, they toss behind their back as they leave for their office. You place the first slide on the microscope stage. So many shades of purple, red, blue, with some black. How do I start? Do I read the WHO? Where is the WHO? Now imagine when you receive the cases, you confidently think to yourself, hours? If I had 5 minutes with this case, I could give an informative preliminary result to a clinician. You already have a big picture grasp of the tasks at hand, and a prepared reading list to begin to fill in your mental framework. You know exactly how to recognize abnormalities, and are ready to begin adding more and more WHO-defined entities to your mental foundation. Now you don't just see pretty colors, but megakaryocytes, erythrocytes, and myeloblasts. Or maybe lymphoblasts. Let's do this. This short guide is based on an introductory talk that I give to pathology residents on their first hematopathology rotation. This usually happens after they have at least 1 year of anatomic pathology training. The transition to hematopathology can be challenging because of the sheer number of entities, variety of diagnostic features, critical importance of clinical history, which may or may not be present with cases, and a level of attention to cell detail that is uncommon in anatomic pathology. Learning hematopathology can be further challenging because of the volume of cases and a misguided focus on merely completing accurate bone marrow or peripheral blood differentials rather than understanding the diagnostic process. This guide shows how to approach hematopathology from a clinically relevant perspective. It is an introductory survival guide. This is not an exam review book. The purpose of this book is to give the resident on their first rotation 1. An initial mental framework for the hematopathology diagnostic process. 2. The essential concepts and vocabulary so they will not be lost when their attending talks about hematopathology. And 3. A roadmap for how to increase their clinically relevant knowledge most efficiently and effectively. Although this is not an exam review book, I believe having a strong foundation will make review for exams more effective because there will be a framework to put all the various factoids in. Now let's begin.